Describe the levels of prevention of diseases. Disease prevention understood as a specific population-based and individual-based interventions for primary and secondary early detection prevention aiming to minimize the burden of diseases and associated risk factors. WHO. The goal of a disease prevention can be summarized under four headings: to promote health, to preserve health, to restore health when it is impaired, and to minimize suffering and stress. Types of disease prevention methods. Four levels of prevention can be identified corresponding to different phases in the development of disease. First, primordial prevention. The aim of primordial prevention is to avoid emergence and establishment of the social, economic, and cultural pattern of living that are known to contribute to an elevated risk of a disease. For example, obesity, hypertension have origin in the childhood when lifestyles are formed. In primordial prevention, the children are discouraged from adopting harmful lifestyles. The main intervention in primordial prevention is through individual and mass education. Effective primordial prevention sometimes also requires strong government regulatory action to stop. For example, the promoting of cigarettes and the smoking should be stopped. Then after, primary prevention. Primary prevention can be defined as action taken prior to the onset of a disease which removes the possibility that a disease will ever occur. For example, the use of condoms for the prevention of HIV infection. Another good example of primary prevention is by immunization. Secondary prevention. It can be defined as the action which halts, stops the progress of a disease at its incipient stage and prevent complications. It comprises early diagnosis and adequate treatment in order to intervene disease process to prevent spread of a communicable diseases to others. Case finding measures and individuals and mass screening surveys together with views of confirmatory diagnostic tests are important for early diagnosis and promote treatment. However, secondary prevention is less effective and more expensive than primary prevention. Tertiary prevention. Tertiary prevention intends to reduce impairments and disabilities, minimize suffering in the late pathogenesis phase of disease. It mainly aims at reducing the progress of a complication of established disease and is an important aspect of therapeutic and rehabilitation medicine. पाँचों में से rehabilitation. When defect and disability are more or less established, rehabilitation may play a preventable role. The defect and disability may be anatomical or physiological. The objective of rehabilitation is to return the affected individuals to his or her place in the society and let him or make maximum use of his or her remaining capacities.